Well, it's a decision faced by many parents. Should they vaccinate their young children against COVID-19? And for the head of New Jersey's largest public hospital, who's also a former commissioner of health, the decision became personal after his 6-year-old daughter contracted the virus.
I felt that the arguments were very strong and continue to be strong for vaccinating your kids, especially in light of Omicron and how fast it can spread in schools.
Dr. Shereef Elnahal is the president and CEO of University Hospital in Newark. He's been at the front lines of the pandemic since the beginning. He's lost friends and colleagues to the virus, and then it hit home.
Our daughter got COVID-19 in May, and of course that was a very scary call, but the scariest thing was that call. Thankfully, she did well with the disease.
Even though Dr. Elnahal believes his 6-year-old may have some limited natural immunity due to being sick, he and his wife decided to get her vaccinated in November.
And I knew it was the right thing to do. The clinical trial results speak for themselves, over 90% effectiveness against symptomatic disease for kids. Very few issues in the way of side effects, no severe adverse events.
Now, Elnahal is opening up about his family's decision, writing an op-ed for Newsweek this month. He's telling parents now to get themselves booster shots and have their kids aged 5 to 11 get their first shots.
It's giving us peace of mind that our daughter can go to school now without us having to worry that she'll get sick from COVID-19. I think that's peace of mind that a lot of parents can use right now.
But both at the hospital he runs and the state's largest city, which it serves, Elnahal says he's encountered some reluctance to inoculate kids with the new vaccine.
I've spoken to a lot of parents, both in the community here, doing my job at the hospital, but also colleagues and friends who are skeptical about using it on their kids to protect them.
In his op-ed, Elnahal also says the simple presence of antibodies in children does not indicate protection from COVID. It remains unclear, however, how resistant Omicron will be to the vaccines in both children and adults. Dr. Elnahal saying over the past month, with the advent of Omicron, demand at University Hospital's vaccination center has surged, and 15% of new vaccinations are for kids.